point of this today is to let people know that, there's no solutions, only trade-offs, right? So the trade-off for SB 216 is that we have to reduce some services to make up the $8 to $10 million. And these are some of those. First off, in our snow operations, we're going to be phasing in city-owned and operated motor graders and phasing out some of our contracted work, which could result in some longer snow clearing times, but it wouldn't affect the quality of how we do snow removal. So we'll still do the curb to curb and how we do snow plowing, but it could result in slightly longer snow clearing times. Our Siouxland libraries, we are going to reduce daily service by up to 2 hours, opening an hour later and closing an hour earlier in all of our Sioux Falls locations and in Brandon. We will be closing the 3 school-based clinics that are run by Falls Community Health. Those are operated out of our schools. Less than 5% of our patients that we see in those clinics are actually kids. And so when I say school-based clinics, don't think that we're robbing a bunch of kids from getting access to health care. That has been actually a poor performing part of our clinical portfolio. We don't see a lot of kids actually in those school-based clinics. So we've decided to close those as a cost-saving measure. This one, our outdoor pools, we're planning starting next year to close those after the first weekend in August, all of our outdoor pools. We see roughly almost a 70% drop in attendance after the first weekend in August in all of our outdoor pools. And we see a loss in staff. We see a huge drop in attendance, so we're going to be closing all of our outdoor pools after the first weekend in August. Our Parks and Recreation team is going to be permanently phasing out all of our non-refrigerated ice rinks starting in 2026 that we operate in the city. We've seen declining attendance in those and really just unreliable operating days in those. The weather is increasingly challenging to keep ice on those. The cost per attendee honestly can range anywhere from $30 an attendee to $170 an attendee just to keep those rinks going. So we're going to be phasing those out. You maybe heard we're reducing the community subsidy agreements that we provide. Those have kind of just been slowly added to and kind of been hung on to in our budget, where we provided subsidies to various nonprofits over the years. We're going to be reducing those by 28%. We're going to be making some staff impacts in the city too. We're eliminating 4 positions that are currently open in the city, in our operations team, our library team, a position in my office we're going to be eliminating in the mayor's office. We're going to be eliminating some positions due to some loss of grant funding and not filling those. We are going to really focus on reducing overtime across our departments. So overtime isn't just done willy-nilly. It's used because the need is there, whether that's with fire or police or in our street department or our parks department. We're going to make a conscious effort to reduce overtime as much as possible. We're certainly restricting employee travel and training as much as we can, much more than we ever have before. And we're also holding our vacant positions open much longer. So if someone leaves the city, if we have turnover, we're not immediately filling the positions. We're going to keep them open. We're going to assess if we need to backfill that position or if it can stay open. And that does not include, however, our public safety positions. We lose a firefighter, metro operator, police officer. We will immediately, obviously, want to fill those again. And so those are just a handful of things. There's going to be more other things that will come out in our budget process that you'll hear about. But it's hard because of the rate that we're growing right now and the historic rate that we're growing, including in our metro area. This is Sioux Falls' approach to this. Brandon, Harrisburg, they're all facing the same thing right now. They're doing this same exercise. Quite honestly, in and Harrisburg specifically, their percentage of recalibrations is going to be much greater than ours. because they're growing at a higher clip than we are percentage-wise.